Okay, let's go ahead and get started. Make sure you place your name and campus in the chat. Place your name and campus in the chat again. Mhm. So the last exam is taken on Friday evening. So the exam analysis will take place after that class ends. So grades will be posted on Friday evening at the latest. Canvas is still out. I don't have any updates on it, but it's still out though. So we will utilize our time to go ahead and put you in your group so you all can be just introducing yourselves and also exchanging whatever information that needs to be exchanged regarding, how you all will contact each other, whether it's going to be phone, text message, thread, whatever works for the group. You all decide that. We still have about two more that haven't made it back yet. So yes, we take our exam on Monday, but we have to wait until the last class test, and it's always on Friday. It's just a little bit later this time. So, but nevertheless, you do want that exam analysis to take place. And then what we'll do is we'll send you a notification that says, grades are posted. All right. So I have placed you all in your groups here. Let me just do two more people need to be assigned here. And so I'm going to open up the breakout rooms so you all can introduce yourselves, just talk and, exchange or decide on what's going to be the best for the group. While we know everyone's not going to agree on everything, but come to some type of agreement that works for majority. And then just know that things may vary, like that you may have to revise your plans, by week 10. But at least you all can meet, exchange, or talk about ways that you all are going to communicate. Text message, thread, whatever those ways are. There's all different types of methods out there. So I'm going to open up the breakout room and give you all time to do that. The few of you all that just logged in, the last exam will be taken on Friday. An exam analysis, that's where we go back and look and make sure things are keyed in correctly. An exam analysis takes place after that last class takes their exam, and then shortly after we post the grades. But you will see that notification via, your announcement section. You may, if you have your grades turned on, it'll pop up in there as well. Okay, so I'm going to open up the breakout rooms and you all, discuss what your plans are, what you think is the best way to communicate. Even if talk about how do you resolve, for example, if everyone has a different idea and we can't come to a conclusion, what is going to be the group's decision or plan to come to a conclusion or decision about whatever it is that you need to talk about. So we'll give you all time to do that. Open up the rooms now, accept the invitation. We'll give you all plenty of time to do that. Pender, you're just coming in. Let me go ahead and we're going to the breakout room to meet our group members, discuss ways that we will communicate for the group project. Just gonna move you over. Emails, text message, whatever it is that you all decide. Okay. Sign to room 3. Okay. And all right, Powell, I'm going to move you over as well. Well, Powell, you're already there. Okay. All right. Just want to discuss some important concepts going forward for the next exam. As always, make sure that you're reading the required readings, assigned readings for those chapters. Make sure so therefore you can have a good understanding of the concept. And so remember, most of the questions are you being able to apply what you know, your understanding about the concept to a situation or a scenario. Okay. So our first concept is care coordination. It is recognized as a professional standard and essential competency for registered nurses. It is a fundamental in improving the quality of care delivery while decreasing or reducing inappropriate use of healthcare services. So just thinking about how can we provide that best care for that patient? How can we coordinate with all of those that are on the healthcare team? Because most of the time, the patient is going to need members from several different, entities of the team: physical therapy, speech therapy, respiratory therapy. But that nurse, you're like that central portion. So how can we ensure that our
Perfect.
patients,
I'm sorry to interrupt. I think you have me in two.
okay, just think about all the different people on the care team that one patient will need to provide their services, their skills in order for them to be taken care of. Like I mentioned, respiratory, the person needs breathing treatments. They had a hip fracture and they're learning to re-walk again. They may need speech, they may need physical therapy as well as occupational therapy. And we have that nurse and that healthcare provider, they're that core. But coordinating the care that this patient needs will actually decrease or reduce inappropriate use of healthcare services. So if we know that this patient, let me give you a scenario. If we know this patient needs physical therapy and therapies in the facility at 9 a.m. on Monday, Wednesdays, and Fridays, and they have a follow-up appointment, we want to make sure that we do not schedule that follow-up appointment during that time that they're going to be in therapy. Because otherwise that patient will be deemed as being missing their therapy appointment. And sometimes depends on what that insurance says, they may receive less services. They may even be dropped from those services because it appears that that patient is refusing, passive refusal of receiving that care. So care coordination organizes care and information around patients' needs and preferences. We don't want to break any rules, but we want to make sure that we ask our patients, establish those therapeutic relationships, find out what is important to them, find out what they know about the disease process, what are their expectations. And we do want to incorporate that in the client's care as we discuss with the RN interventions that need to be implemented. Care coordination organizes care and information around patients' needs and preferences. It is one of the 6 priorities that are identified by the National Quality Strategy for providing more affordable, improved, and patient-centered care. The Patient Protection and Affordability Care Act identifies care coordination as key in shifting towards value-based care models. So effective care coordination helps prevent fragmentation and cost inefficiencies and poor health outcomes. So it is important. It is really, really essential that we coordinate that client's care so that they can have the best outcomes, that best quality of life that they can while decreasing health costs. The ACA, that Affordable Care Act, identifies care coordination as fundamental. It's really, really important in helping the healthcare industry move away from those fee-for-service models. So those fee-for-service models were where a person wanted lab draw, so they paid for that. They wanted an x-ray, they paid for that. Everything fee-for-service. They can have whatever service, but each service was fragmented. It was specifically and that's all you got done. It didn't consider the condition of the client. Well, the client that has broken hip, they're going to need x-rays. They're going to need follow-up labs. They're going to need therapy. And so, but the fee-for-service model would have taken each one of those services independently. So the Patient Protection and the Affordable Care Act, it emphasizes care coordination. It wants to shift to that value base so that client can receive the best care possible without any breaks in care being received and just having that highest quality of care being provided for them. Okay. So let's talk about a handoff report. So we know we use the SBAR. That's that tool that we use. We can use it when we're reporting a change or some new information to our healthcare provider about a patient, and or we can use that handoff report. It helps ensures that the next person, the next provider, the next nurse understands and knows what that patient needs, what their medications are, if they have any special devices, whether they're on oxygen, whether they're on breathing treatments, if they have any follow-up care. And it provides that, clear information um, about what's going on with that client. Now, when we're talking about discharge instructions, this is instructions that helps that client maintain or manage their care. And it keeps that client safe as well. So discharge instructions are going to be information that supports that patient's safety, especially those that may have memory problems, or if it's a new diagnosis for them. Those are usually listed as discharge instructions. But a handoff report, we're leaving and we're giving we're returning the care over of the patient to the next healthcare provider that's coming in, to the next nurse. So it is very important that we give them that key information, because from that, they establish their deadline, their baseline. So when they go in to assess the client and take care of the client, they have that information that we've given them, and they compare it with what their findings. Well, hey, and then they decide, well, have this client changed, or are they the same? Okay. Again, we talked about continuity of care, that care coordination, and that continuity of care is almost the same. It involves that seamless transition. If the patient is leaving from acute care going to home, patients going from the hospital to the skilled nursing facility, there is communication about everything from A to Z about that client, so that there is a seamless transition, so that patient, there's not a drop in level of care just because that client is going from a different setting to a different setting. So that continuity of care ensures that the patient information and that the treatment plans are effectively communicated and maintained no matter which setting that they go to. Hospital, skilled nursing facility to home, or from hospital to home health. But there's that continuity, that continuation of information that is shared to all the different people that's in the different settings and all the different providers, no matter where they're at on that team. If they're providing care for that patient, then that information is shared with them. Okay, just remember continuity of care and that coordination of care. That coordination of care leads to that continuity, being having an open, honest communications with our client. Okay, effective continuity of care, especially for older adults and those that have multiple chronic conditions, can really, really decrease the amount of time that these people are readmitted. So we really do need to take the time anyways, because that's what we're supposed to do. But just think about it. If someone would have just ensured that this client knew was really that they understood whatever the discharge instructions were, whatever was expected. You're expected to go to the skilled nursing facility. Once you get there, the therapist will work with you, and it's expected that go to the therapy room or be involved with the therapist as they come. Effective continuity of care. Just think about if we're coordinating that care and we have effective continuity of care, everybody on the healthcare team, everyone that is responsible or having part in taking care of this patient knows what they need to know about this patient. They know that this client has therapy. They know this client's on a special diet because the dietary department has come in. Everybody's been communicating. This client, we've ensured that the client really understands, and the things that they don't understand, the teaching, that the reinforcement of instructions that we're giving them, we're making sure we're coming back and reteaching and reinforcing. Just think about what they, and we've identified the resources that they'll need. For example, if they're leaving skilled nursing facility and going home, we've identified the resources that are out there in the community. Everything is set up for this client. Just think about how that will affect readmissions to the hospital. It will greatly, significantly reduce hospital readmissions. So we want to make sure that our care includes follow-up, medical management, coordination between those care providers, and patients. They're more likely to maintain their health and avoid complications that could lead to rehospitalization. Because first of all, we've identified what their needs, their understanding, we've cleared up. We've given them information to increase their knowledge base so they can manage their disease process. We've identified resources. Everyone on the healthcare team has come in. Dietary has come in and did their nutritional assessment. Not only that, they know the client's preferences. The client knows what's expected. All of these things. And once that client gets home or even go to that skilled nursing facility, it decreases the likelihood of them having to go back into that hospital. It decreases the chances of that, which is good. That's what we want. Okay, so we do want to use assertive communication. It involves expressing ideas and opinions openly while remaining respectful to others. Um, we do want to let everyone share their ideas. If people have some ideas, it's okay to listen to them. You never know. We might change what our idea might be. We might not, but be open to improving what the process is and be open to sharing your ideas. And we want to discuss that. It might take more than one discussion. So, but assertive communication is respectful, is direct, and then the whole idea is ensuring that the patient is safe and that we have that continuity of care, that care is coordinated. Okay. So we do not want to place blame on others. We want to make sure that the environment is safe. We do want positive outcomes. And with those positive outcomes, they will include improved teamwork, recognition of valid clinical concerns. We'll be able to quickly identify, if there's a change in our patient. Also, it strengthens our patient advocacy. Okay. So assertive communication includes allowing the sender, to finish what they're stating. Um, if you're in report, it's okay to allow that person to finish. And then you want to come back if you have some follow-up questions, you have to jot them down and ask those questions. But don't continue to interrupt because they're telling you what happened during their shift. And if you need clarity, that's fine. You get the clarity, but you wait on, the appropriate time to actually respond. Okay. And then you do want to acknowledge in the event, in order to have those positive outcomes, if we see that the interventions that we're implementing, that they're not doing any good, we do want to acknowledge that these are our findings. Had a discussion with that registered nurse because that care plan may more than likely will need to be adjusted. So don't be afraid to communicate. Being assertive is not being aggressive. It's not being belittling or any of that. It's allowing the person to speak. It's the whole thing is being respectful, ensuring that the patient's safe, and we're doing what is best for the client. Team communication. Sometimes you'll even see where they do the stand-up morning meetings. They have a team communication huddles. Depends on what time of day. They may have one before going home and one at the beginning of shift and the end of shift. Assertive communication often involves using I statements to express one's thoughts, feelings, and needs clearly and directly. This approach allows for honesty of expression without blaming or attacking others, and it promotes effective interpersonal communication. That is assertiveness, not aggressiveness. Okay. And so with assertive communication, We do make eye contact. We can look away. We don't have to do the sustained eye contact because that's kind of considered as aggressive, but make eye contact. We do want to speak in a clear tone, with that steady voice. And your posture, you want to consider your posture. We do want you stand erect, usually hands open, that nice, confident posture. Excuse me. Assertiveness is a self-expression that respects both the speaker and the listener. It involves communicating thoughts and feelings and needs clearly and directly without being aggressive or insulting others.
All right, see you later. Wait, for sure.
Everyone should be coming back within a minute or so because it's almost time to end. So we'll wait till everybody get back. Just a few more. Just a few more. They're still talking, but we're gonna close on out here. Wait till everyone gets back in. Canvas is back up, you all. Canvas is back up. Just a few more, about 5 more to come on in. And I'll repeat myself because I don't want to run you over your time. So so don't wait until class time just to communicate with each other. We will give you time to actually talk during the class, but that is not the only time that you all should be communicating, revising, and coming up with your plan so that you can have that good solid product for week 10.
Can I ask you a question? So does it have to be a poster or can it be a PowerPoint?
It depends on what that rubric say. I'll have to refer back to it because I can't answer that off the top of my head because it's another group project and I don't want to say the wrong thing, but refer to your rubric. That's what you're held accountable for. So again, the last class, I know y'all want those scores. You can't give a thumbs up or a frown or a smiley face, but as soon as that last class finishes on Friday, we will do the exam analysis and then we will post your grades. The content for this week, once I finish recording, I've already been recording. Need you to go in and just start looking at it because week 6 comes around really, really fast. So I have a little bit more information to add. So as soon as I finish recording, I'll download it and upload it and post it and send it out to you all. Start looking at your schedules because you have most of you have more than one class, work, play, home, a lot of responsibilities. So just be looking at those things to see what you need to rearrange, put on pause, and all of that. All right, and it is time to end. Take
I do
care.
have a quick question.
For those of you all that don't have a question, you can go ahead and log off. Yes, what's your question?
For each of our topics, are there like sub? I don't even know the word for it. Like subtopics within that topic inside the book.
If yes, now it's the opposite of what you said. But yes, what you're saying is I understand what you're saying.
Okay, so
Yes.
there's subtopics within our topic
Yes,
inside the book.
yes.
Okay.
Yeah. It's more than enough information out there. It's just more or less really working with someone. This is more than just finishing the product. It's that because you're getting ready to be right there. You're gonna be those leaders. So it's getting you to transition really on working with someone. The information is there. You're gonna have more than enough information from the book, your experiences, your understanding. So that part is going to be good. Just make sure that you're working with each other, listening to each other, sharing ideas, be open to new ideas. That's really what that group project is about. But you all do well though. Take care.
Alrighty. Thank you.
You're welcome. Miss Flores, Miss Quarles, are you all okay? You have a question for me? Okay. Even though we attempt to communicate effectively, we allow the others to speak without being interrupted. We're open to ideas. Sometimes, even though we're trying to be respectful, sometimes there's still conflict. Conflict may still arise. So, nevertheless, there is opportunity for growth and learning within, even if conflict does show up. And so again, we do want to find out like what really is the conflict about, because sometimes it's not what we think. So identifying what the conflict is really about will help us to identify what a resolution should be. Nevertheless, we do, it's opportunity for growth and learning. We want to make sure that our communication is clear. Try not to use slang. Make sure that we're using whatever vocabulary, like if we're talking about the respiratory system, use whatever vocabulary that applies to that system, because we don't want miscommunication. A person is thinking that, you're talking about something and you really are not. So tools to reduce conflicts include clear communication and then the ability to work well on a team. It takes that team to provide that, to coordinate that care and to provide that continuity of care for that client. So we do want clear communication. We do want to include our client preferences. We do want to encourage our client to open up and communicate with us. And we want to encourage our team members to open up and communicate with us, even if there's a conflict, because we need to identify whatever that is, the issue or the concern is, so that we can get a resolution. So encouraging open communication allows the patient, the team members to express their concerns so that we can work towards a resolution, which aligns with the principle that when conflicts are out in the open, there's opportunity to settle the issue. There's opportunity for growth. There will be, now this will be an additional task on, for the most part, all healthcare facilities have what they call an ethics committee. And so this is like an additional task that you would have as working as, your regular task as a nurse. So that is a committee where if issues cannot be resolved, that information will be brought to the ethics committee. Now the ethics committee might well, of course, we'll have to collect all the data. That may be statements, it may be video footage. It might be statements from the family. It might be from the different people on the healthcare team that's taking part in that patient's care. But nevertheless, we do want to resolve the conflict. So we might have to bring in that ethics committee to assist. But even before we get there, we do want to remember, our posture, our being assertive. That's not revising or changing things or changing policies, breaking rules. That does not include that. Being assertive does not mean being aggressive. It means being open and honest with that client. And that will lead to less conflict with your clients. So just be thinking about some situations or some examples of where conflict can arise, and then remember when we're talking about assertiveness, we use those I statements to express, our concerns respectfully to come to a solution. Okay. While the chain of command is important for organization structure and communication, it should not impede or stop urgent patient care or safety concerns. In emergency situations, immediate action may be necessary by bypassing the usual chain of command. Healthcare professionals have a duty to report critical issues directly to those who can address them promptly. Following the chain of command in all situations could lead to delay in care and compromise the patient's safety. So the chain of command is good, but think about it. If it's in emergency situations, we want to communicate with those that are directly involved and can address whatever the issue is promptly. So the chain of command is important. We do want to follow the order, but think about it. If it's an emergency and I am not directly involved in that patient's care, we want to bypass me, that person, because it's an emergency. So again, if a person is involved directly in that patient's care and it's an emergency, we want to bypass the chain of command to address and resolve whatever it is promptly. Okay. The chain of command in nursing is designed to create a structured system of authority and responsibility. You all can be those leaders in those long-term care facilities. And so you have to make sure that we are communicating, having open communication, being assertive, being honest. The chain of command, it ensures that information and decisions and concerns flow efficiently through all the appropriate channels, facilitating effective management and problem solving. So, because you don't want to skip a piece in the chain, because then that may end up, that patient might not get care that they need, that they really needed. So the chain of command in nursing is designed to create a structured system of authority and responsibility. It ensures that information, decisions, and concerns flow efficiently through the appropriate channels, facilitating effective management and problem solving. That clear line of authority and responsibility. Competency means understanding your scope of practice and skill level and knowing when to ask for help or delegate. Empathy and compassion are valuable traits, but they do not reflect the ability to assess one's professional capability. So that's competency that assesses a person's capability and their skill level. Okay. Confidence helps with communicating, but it does not guarantee that this person can perform the skill effectively. So we need to know the difference in those. Competence in nursing involves combining theoretical knowledge with practical skills and the ability to make sound clinical judgments. Okay. That competence, taking those skills and being able to make sound clinical judgments. Receiving that report from your that handoff report from the nurse. When you go in to assess the client and you realize, you look at what the information that they gave you, okay, this is a change for my client, or this client is the same. It involves in you making that sound having that sound judgment, being able to determine, is this a change for my client or not? You receive lab results. They're critical because you remember what the lab results are. For example, for potassium. So what's the next step? So you just take that information and just type it or put it in that client's record. That value is high. So there's going to be some communication to a healthcare provider because that client is going to need an intervention implemented to bring that potassium level back to normal. So being able to make that sound judgment is going to be critical. So usually you will have a mentor, which is usually someone that you can go to for guidance, and they usually are experienced, and you'll become experienced and develop your time management skills and your competence over time. So you are getting that strong foundation so that you can apply it, and you've already kind of tested out with your clinical sites. So you go in there and you're taking care of real patients, thinking about real-time information that's going on, and you're making those sound judgments. You're actually more than likely discussing those in clinicals. Competence should be continually evaluated and improved to ensure that we are providing that high quality of care to our patients, that best care. And so that's more than likely why the states always request that you have that continuing education so that you can have knowledge of the latest information, the latest best evidence information so that we're providing the best care for those clients. So it's a continuous process. Competency, again, means understanding your scope of practice and the skill level and knowing when to ask for help or to delegate. Because if this client is stable, and this is a task that we can delegate to a licensed personnel, why not delegate it? Because it frees you up of having time to do things that cannot be delegated. It allows you to, have more time management and the complete task in a timely manner.